So let's dig into assessment. We have our visual assessment is we're just going to look at them up and down, top, bottom, conformation. We're going to look at how do they look there. Are they, a horse that just is constantly doing this, switching weight side to side, that horse is in pain. So there are certain things that you can visually see right away, posture, all kinds of stuff. Skin, what I'm saying there is visually, if you see like fungus or bacteria, you're not going to be able to tape that part of the horse's body anyways. And when I say demeanor, I'm just going to give a quick equine psychology lesson here. Horses that are in pain, and a lot of people won't recognize that their horse is in pain. So let's talk a little bit about what does that look like. So one thing is that constantly switching weight side to side or rocking forward to back, front leg to back leg. If you see a horse that will stand in a pasture, a stall, a run, something like that, with their head in the corner, that's pain. If you ever see a horse brace with its head on a fence, on anything, you've got massive hip pain, maybe even a fracture, right? Pain looks very different in horses than what we tend to give it credit for, all right? So here's some tips. As body workers, chiropractors, if you don't know how to take respiratory and heart rate, learn. Vets and vet techs already know this. Trainers, riders, grooms, horse owners, if you don't know how to take a respiratory and heart rate, learn. You can learn how to do it on YouTube. All right? If you suspect any of those list of things I just said your horse is doing, ear pinning at nothing, like, oh my gosh, my horse sees shadow people. Ear pinning at nothing is pain. Obviously, kicking at their body, thrashing of any kind, kicking at a stall. They're not pissed. They're in pain. Any of those signs is important to note, okay? So that's how one of the things that we're talking about behaviorally speaking is that. So heart rate and respiratory rate can't lie. Now, in order for this diagnostic to be effective, you must know your horse's resting heart rate and respiratory rate. And it does change within the breed, right? Normal is a big range. So once you learn on your horse, do it frequently so that you can get a nice baseline of their base. And then you'll be able to know. If you see some of these signs, you can do a quick heart rate, respiratory rate track, and you can say, oh yeah, we are elevated. Now it's time to call the vet, right? And you can tell them, well, my baseline is here, and this is where I'm at. They're going to be super impressed that you know that, and they're really going to take that symptom more seriously, okay? So also, equine psychology is probably something everybody should look into. I say it in every course I teach, but here's some of the reasons why, right? Okay, so that's visual. Physical is us touching, right? Testing range of motion, stretching the horse, all of that. So that's what your physical hands-on is. Biomechanic is watching them move. I really like to see a horse do all kinds of movements. So I'm going to have them walk towards me, walk away from me. I'm going to walk with them and watch them from the side. I like to see them back. I like to see them on a 20-meter circle, both at a walk, trot, and a lope. And what if you're like, oh my gosh, but my horse is lame. I still want to see him at least walk, trot. And I know, but it's just like like if you've hurt your leg and you're like, okay, this is what you look like trying to jog, it really tells you what's going on. So biomechanic is just that. And then collaborate, this is where we're talking about the other people that seen my horse in the barn, my body worker, my vet, my farrier. We're going to talk about the collaboration piece a little bit more because we don't do it enough and we're not very good at it, right? And so as horse owners, we need to learn how to communicate with the body workers and the vets and that kind of stuff better. We need to have a more clear communication. What am I seeing, right? So if I say my horse is just limping, right, you have to learn how to to clearly communicate what you're seeing. If you're a body worker and you're trying to communicate with the vet on this horse, you have to really start communicating well about what you're seeing. This is what I'm seeing. This is what I want to do. Right? They're going to start taking you more seriously. So that's important. Also, history is huge, and I don't know why we've gone away from it as professional body workers, chiropractors, even vets. And I don't know if it's just keeping track of it. There are really good softwares and programs and systems now that help you keep track of history on these animals. But history is huge, and all the things that we don't think about, like if you ask somebody, like, is your horse had an injury recently or whatever, and they're not going to consider when they saw them running around bucking and slipped and fall in the pasture an injury. Right. So you almost have to jog people's memory. Has the horse fallen recently? Maybe was running around, slipped in the mud, like that kind of stuff. So history is super important. And then any kind of diagnostic test that has been done on the animal, and I will go back years, especially x-rays. I want to see it. You got a copy of it? Let me see it. Blood work, chems, all that. So fecals, all of it. All of this is very, very valuable information. So that is what assessment is. It's a big deal. It's all the pieces, right? Any questions on assessment? No? Okay. So now let's talk about the objective. We're going to really dig into it more. Anything training is anything that is getting me to, maybe it's my athletic goal. I'm got a level 1 dressage horse and I want to make it to level 2 by the end of the year, right? So anything that's helping me get to my training goal, competition goal. Maybe I've got a 3-year-old and they're starting under saddle, and I want to make that start as good as possible, right? I don't want him to get sore. I don't want those things to happen. And so I'm going to maybe do some muscle relaxation applications after I get done riding so that they're not back sore, their butts don't get sore, their shoulders don't get sore. That's still training, right? You're still in that. So if you're conditioning, you're training or competing, you're living in the training world, right? Anything that's preventing injury, anything that is helping reduce fatigue, any of that kind of stuff. So you can have the same fetlock application be in a training world and a therapeutic world. It's still the same fetlock application. We're just using it for 2 different reasons. One is maybe to help get over an injury. The other one is to help prevent one. Still the same application, can live in 2 different worlds. And therapeutic is anything that's correcting something, anything that's helping you recover from something, anything rehabilitative. So that's why I tell you, it's not going to be both. It can't be training and therapeutic. If there's a therapeutic side to it for any reason, the entire application is now thrown into the therapeutic world because that's rehab. So this is tears, ruptures, swelling, edema, um, atrophy, like all of that. Any questions between the two and how to kind of judge it, or yes, no? It's really, this is really only going to be super important for um, your pros, as a horse owner or, a barn manager or trainer or something like that. You're probably not going to get caught up on, is this therapeutic or training too much, but your pros will for sure. It's one of your diagnostics to push you into the right type of application. Okay, so our goals. Now your goals are, again, only the 6 is the world you'll live in, and you can have combinations of them. So I might have a support and relaxation in one application, or it wouldn't be one application, but on one horse, if that makes sense. But it's always going to be within that 6: muscle relaxation, muscle assist, support joint tendons and ligaments, circulation. This can be blood, lymph, anything fluid really. fascia, decompression. Anytime we utilize two things in one, like maybe I'll do a muscle activation with a decompression spot because there's maybe a trigger point in a muscle. So I want to activate that muscle and relieve the trigger point in it. So that would be two different types. You would have a muscle activation, decompression, but it's one application, right? So that's combination. Any questions about this before we move on? No? Okay. All right. So the technique is everything from how long of a piece you're going to use, what pattern are you going to use, what cut pattern, how much stretch are you going to use on it, where you're going to put it on the horse, the direction that you're going to put it in. Thinking about things like, can I start with the lie of the hair or not? Because that's going to change my technique a little bit. It's going to change how I put it on the horse initially up front. So all of this is a part of that. When you do your case studies, so when you're certifying out, you will be submitting case studies in this format. What was your assessment? What is the objective? What is the goal? What is the technique you used? And what were your considerations? You have to tell me that on every horse. So this really comes into it. Well, I used this piece, this direction went this way, this recoil. Make sense? Any questions on that? Elliot, anything online? Cool. All right, so let's talk about considerations because this to me is everything. Um, and when you do your case studies and you fill out your considerations and it's like I told them to retape in 3 weeks and that's all you say, I'm probably going to fail your case study, which will fail your exam. Because if you fail one case study, I fail your exam. You can miss 5, 6, 7 in the actual written exam, but if you fail a case study, there's no point. You know what I mean? It's like, let's redo that case study. So what are considerations? It's everything. They're on hormonal medication and X, Y, and Z, right? It's not going to be effective. However, I'm going to reduce MagnaWave for the next 6 weeks. You see what I'm saying? So all these pieces we've been talking about is going to go into it. Maybe your case study is your DSLD horse that you're working on. So one of the considerations is the farrier has to be present and trim at the time of the application. Also, once it stops recoiling, it needs to be redone. And we're going to do this for X period of time. Make sense? If we're taping for an abscess, are we going to be poulticing over the top of it? Are we going to be soaking over the top of it? If so, let's make sure that we do some pretty insane surface prep. Let's back our stretch off a little bit, maybe put a couple anchors in there so that our application has a higher rate of holding through the soaking. Because especially, I mean, people sometimes go nuts and they'll be soaking those horses 3, 4 times a day on an abscess, right? So let's make sure our application can hold up to that. So these are all considerations, right? So when I say everything in the horse's life, I mean it. And I want to see that in your case studies. But this will train you to think about the application. You may say, okay, nobody is going to see this horse for 6 weeks. Literally, the person who shows up to feed them because everybody's out of town, really they're only they would recognize if the horse was laying over. Past that, they wouldn't know if anything's wrong, okay? So this is what they've got for 6 weeks. Am I really gonna do an application? No, I'm gonna wait for 6 weeks. So I might see this horse and be called in to see this horse and like, oh, I've got this thing going on. And you're like, great, can anybody tape it for the next 6 weeks? No. Okay, well, I'm not putting tape on it. I'll be back in 6 weeks. Right, so the consideration sometimes will throw you all the way back into either changing your application, changing the technique that you're using on it, or not even taping at all. Right? Maybe you've got somebody, a groom who's willing to learn because this horse needs to be taped weekly for the next 12 weeks, and the groom's willing to learn. And you watch the groom tape and the techniques are whoa. And so you take your application from maybe a very complicated combination application and you really simplify it so that that groom can repeat it every week. Does that make sense? Okay. And I know I pick on grooms. They're really good and they're generally better tapers than most of us. But I just say it because I think most people understand, like, the groom is working with the horse a lot more than we realize. So, any questions on considerations? What we consider considerations, I guess. Nope, nope. Elliot, we good?